Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Propranolol. Its brand name is Inderal. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Propranolol is a non-selective beta blocker that reduces chronotropic, ionotropic, and vasodilator responses to beta adrenergic stimulation by competing for the active binding sites that stimulate beta adrenergic receptors. Medication can control hypertension, tremors, as well as migraines through mechanisms that are still not completely understood. There are several different indications for use for propranolol, so I'll list off some of those here for you now. It can be used to help treat chronic angina pectoris. It can be used in public speaking when people have a lot of anxiety before they go up to the podium. It can be used in cardiac dysrhythmia. Some patients do use propranolol to treat essential tremors. There is a place for propranolol in the treatment of hypertension. It can be used to treat idiopathic hypertrophic subaortic stenosis. It can be used for prophylactic treatment of migraines. And finally, it can also be used in post-myocardial infarction syndrome. Now, before somebody was to use propranolol, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. It's contraindicated to be used in patients who have a blood pressure less than 50/30. Patients with a history of bronchial asthma or bronchospasm should not use propranolol. Patients in cardiogenic shock or those who have decompensated heart failure cannot use propranolol. It also cannot be used in patients who have a heart rate less than 80 beats per minute. It cannot be used in premature infants who have a corrected age of less than 5 weeks. If a patient has second or third degree heart block and no pacemaker is present, they cannot use propranolol. This would be the same for sinus bradycardia, as well as sick sinus syndrome. And lastly, it cannot be used in infants weighing less than 2 kilograms. Now, in terms of precautions, cardiac failure or cardiogenic shock can occur while using propranolol. If this was to occur in a patient, the dose would have to be reduced or the medication would have to be stopped. Patients who have Wolff-Parkinson-White syndrome who use propranolol may be putting themselves at an increased risk of experiencing severe bradycardia to the point where they may need a pacemaker. Patients with this syndrome who choose to use propranolol must be monitored very closely. Patients with compensated congestive heart failure may experience worsening of myocardial contractility. This could result in a worsening of their symptoms. Patients with occult coronary artery disease may put themselves at an increased risk of a myocardial infarction if they stop the medication abruptly. Some serious skin reactions have been reported with the use of propranolol, such as Stevens-Johnson syndrome and toxic epidermal necrolysis. Patients with diabetes must also use caution with propranolol, as it does have the ability to mask the signs and symptoms of hypoglycemia or low blood sugar. Hypersensitivity reactions, including anaphylaxis, have been reported with the use of propranolol. Exacerbations of myopathy or myotonia have been seen in patients using propranolol that also have skeletal muscle diseases. And finally, it's not recommended to be used in patients who have bronchospasmic lung disease. Once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to use propranolol, they can expect to typically take it in tablet or solution form. When using propranolol to treat chronic angina pectoris, typically anywhere from 80 to 320 milligrams would be given daily. This would be divided up in doses of anywhere from 2 to 4 times a day. For the extended release version of the tablet, we would just give 80 milligrams once daily and then increase this dose every 3 or 7 days to reach a max dose of 320 milligrams a day. When a patient is using propranolol to treat that anxiety that they would have before a performance or a speech, something like public speaking, they can expect to take 10 milligrams about 1 hour before the event. In treating hypertension, 40 milligrams given twice daily would be an appropriate start, and then maintenance therapy would be anywhere from 120 to 240 milligrams daily, again divided up into 2 or 3 doses throughout the day. Maximum dose in this situation would be 640 milligrams in 1 day. When treating migraines, a daily dose of 80 milligrams would be appropriate, again divided up throughout the day. And then as patients move forward with their therapy, they can expect to reach anywhere of a dose of 160 milligrams daily or 240 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using propranolol, so I'll list off some of those here for you now. Diarrhea and vomiting have been reported in patients. About 4 to 7% experience dizziness. Some people experience sleep disorders, while others, 5 to 7%, experience fatigue. Bradyarrhythmia, cardiogenic shock, or congestive heart failure would all be more rare but serious side effects that may occur. Those serious dermatological conditions such as Stevens-Johnson syndrome and toxic epidermal necrolysis have also been reported. Bronchospasm, anaphylaxis, as well as hypoglycemia would also be rare but serious side effects. That's all we're going to talk about today with Propranolol or Inderal. As always, I'm thankful that you took the time to come by and watch one of my videos. If you thought the information was valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.